There's no one else, any other comments or questions before we close this public hearing? I'm closing the public hearing on House Bill 2095. I'm opening a public hearing on House Bill 2528. Hi.
Oh, thank you, Madam Chair. Members of the committee, House Bill 2528A comes to the committee from the House Committee on Commerce and Consumer Protection. It adds nicotine derived from any source to the definition of tobacco products for purposes of regulation and taxation. It does exempt FDA-approved cessation products from the new tax. It also prohibits all delivery of tobacco and nicotine products by requiring sales take place on licensed premises. Changes to the regulation apply October 1st, 2025, and the taxation of additional products begins January 1st, 2027.
Thank you. Committee, this bill is a little different than some of the others we've been hearing. Any discussion or questions for LRO before we start the hearing? It's fine to make sure we're all understanding what's in front of us. Okay. We have at least 21 people signed up to testify. After our opening presentation, after the first speakers who will give us a grounding in the proposal, I'm going to very likely, I'm going to look at the list and make sure I understand how many are signed up. It's very likely you will be limited to 2 minutes each after the first speaker. I'm calling first on a representative from Oregon Health Authority, Sarah Wiley. After Sarah, I'd like to hear from Sarah Lochner. Sarah, I will give you like about 5 minutes to make sure the committee understands what the bill is about.
All right. Thank you. Good afternoon, Chair Nathanson, Vice Chair Reschke, Vice Chair Walters, and members of the committee. My name is Sarah Wiley, and I'm the manager for the Tobacco Retail License Program at the Oregon Health Authority. And I'm pleased to speak with you today about House Bill 2528, now A, which is an agency bill introduced on behalf of our agency. So for the purposes of the hearing today, I'm not going to talk about the burdens of tobacco use. I think we're well familiar with those. Instead, I'm going to focus on regulation of nicotine products and the provisions in this bill.
And thank you for doing that, because a lot of the purpose of the bill was discussed in a prior committee, the health issues. And we are, as you pointed out, focusing on this bill and the relation to Revenue Committee and taxation.
Absolutely,
so
Chair.
Thank you.
Yes, and I'm happy to answer questions as well on the health or other aspects as well. So looking at this slide, this covers what products are regulated in Oregon and which products are not regulated in Oregon. The U.S. Food and Drug Administration, or the FDA, regulates tobacco products containing nicotine from any source. But federal enforcement is limited, and we've also seen recent dismissals at the FDA. And so state laws and enforcement are essential to hold retailers accountable to the same standard across the state. Currently, Oregon tobacco laws do not cover all tobacco products. Inhaled delivery systems, like e-cigarettes, are covered under Oregon law regardless of the source of nicotine. But oral product regulations are inconsistent. Chew and snuff that have actual tobacco leaf can't be sold to people under 21, but oral products with tobacco-derived or synthetic nicotine aren't held to the same standards, either in terms of the public health regulations or the taxation that Oregon currently has for other tobacco products. There are a lot of retailers, and I do want to emphasize this, that will deny sales to kids based on federal law. But we also know that there are other retailers that exploit the state loophole and sell these products to underage kids in Oregon. And so with increasing number of kids using these products, The state loophole makes regulation inconsistent. It's harder to communicate to retailers which products are in and which products are out of our regulatory framework. And it also leaves gaps that protect the public and especially kids from addictive products. So I want to make a very important point. Tobacco-derived or synthetic nicotine products and pouches that we're talking about today are not FDA-approved quit smoking products. Some of these have been approved as reduced risk products by the FDA, and we can certainly talk about what that means. But these are not the 7 approved medications to help people quit smoking. Those medications are safe to use and increase the chances that somebody will quit nicotine addiction for good. And those cessation products, importantly, are also free through the Oregon Quit Line and all health insurance plans in Oregon. Nicotine pouches, which is what we're talking about regulating today, are not safe to quit tobacco. They are not free. Nicotine is highly addictive, which can make it hard to quit using these products for good. So just showing specifically which products we're talking about, I think many of these will be familiar to the members of the committee from convenience stores or from supermarkets. These products contain small fiber pouches that have nicotine salts. They do not contain cut, ground, powdered, or leaf tobacco, which is how they fall through a loophole in Oregon's current regulations for tobacco products. And then many of them are also flavored. The loophole that we see here in Oregon is, I think, one of the continued examples that we see of tobacco industry innovation to evade existing regulations. There's also a wide range of nicotine nicotine levels in these products. And so then to move on to the specific provisions in House Bill 2528A. So this bill aims to close a series of loopholes in Oregon's tobacco regulations. As I've emphasized, current Oregon law has not been updated to cover these new tobacco-derived or synthetic nicotine products. And this puts youth at risk of addiction and lifelong health problems. Nicotine products such as these are also untaxed, which makes them cheaper and more affordable to youth who are very price sensitive and less likely to buy tobacco products when they are pricier. Oral nicotine products aren't covered under the state minimum legal sales age laws, and they're cheap. And so House Bill 2528A addresses both of those issues to reduce youth access and appeal of these products. The taxes currently proposed in House Bill 2528A would basically incorporate these products into the existing smokeless product regulations. And so that's 65% of the average wholesale price excise tax on modern nicotine products. And I just want to emphasize also that this is not a ban on these products. Adults would still be able to legally purchase these products in Oregon. The goal is to bring parity to other tobacco products. The figures that are on this slide in terms of the revenue generation refer to the 2027 through 2029 biennium. And so that would generate around $15.2 million for the Oregon Health Plan and about $1.7 million to the Tobacco Use Reduction Account and some additional revenue for the general fund as well. The reason this is the 27 to 29 biennium is because to allow for enough time to implement the increased tax, the tax would not go into effect until January 1, 2027. And so there would only be 6 months of revenue for the 2025-2027 biennium. There were a few other small changes that are in this bill. So the Tobacco Retail License Program is a relatively new program, and as we've launched inspections statewide, I think we've seen excellent success in bringing down the sales to underage people. But we've also noticed things in stores that we believe are loopholes in current regulation. So one of these is to close a face-to-face delivery loophole to make sure that youth can't purchase tobacco products online and have them delivered by an employee of a store. Another would clarify laws to prevent tobacco products and inhalant delivery systems from being prize machines that youth can win. These are a few pictures that our inspectors have seen in stores. The red circled products are tobacco products and inhalant delivery systems offered as prizes. And then in addition, Oregon currently has 2 sets of tobacco control laws. There's one for businesses and one for individuals. And when the Tobacco Retail License Program was put in place, the legislature really made clear that they wanted license holders and businesses to be accountable to sales regulations. And so what House Bill 2528 does is really clarify that it's retailers that are responsible for sales laws and not individuals. And then there's an additional this sixth provision here. So the bill would authorize OHA to adopt rules necessary for the effective administration of our public health statute. And this is a narrowed rulemaking scope that was in response to concerns that came up in the House Committee on Commerce and Consumer Protection. There is also the possibility of a -2 amendment, I think, depending on the legislature's discussion, this committee's discussion on revenue. Oregon regulates tobacco products in two different places. One is for public health, one is for taxation. And so the taxation piece could be separated out if the bill were amended in this way. And so that could be an amendment considered by this committee or others. So in sum, this bill, 2528A, these are the outcomes and the equity impacts that the health authority would be looking for from this bill. We would see decreased youth access to harmful tobacco and nicotine products, ensuring that all nicotine products are held to the same regulatory standards and can be held in compliance with state and federal laws. And then we would also be looking for consistent and comprehensive regulation of tobacco products to focus on retailers and to create a consistent and even regulatory environment. I am happy to answer any questions that the committee members have about the bill.
Thank you. Yes, Representative.
Thank you, Chair. I just have a quick question. So the pouches and the lozenges, and you had Zyn up there. In talking to people about this bill, people that I know, I'm surprised how many people I know that use those products to help curb their addiction or whatever you want to call it to vaping or cigarettes. And so if that's how they're using it, why is it not a cessation product?
That is a choice that the manufacturers would have made when they were getting authorization for these products. So the US FDA allows for manufacturers to get pharmaceutical approval to have a product treated as a medicine. And so that's when we see patches, lozenges, nicotine replacement therapy, other pharmaceutical products that are approved to be prescribed or accessed by adults through the Oregon Quit line to help people quit nicotine for good. These are approved as reduced risk products, and so that means that the manufacturer went through a different pathway to have these approved as less harmful for adults who might be trying to quit or cut back on other tobacco products. But I think it's really important to note that for youth, the FDA is really concerned about these products, which is why they are considered tobacco products federally. It's just that we can't enforce that because it's not currently in Oregon state law.
Thank you.
Any other questions? Yes, Representative Reschke.
Thank you, Madam Chair. I have three questions. My grandfather was a Baptist preacher, so everything comes in threes. So hopefully that'll be okay. Normally he would alliterate. I'm not that smart. So first of all, good afternoon. Thanks for being here. On the top of page 2 of the bill, in section 1, it reads, any product that is made from or derived from tobacco or nicotine derived from any source that is intended or likely to be used for human consumption by any means, including but not limited to, and then it lists a whole bunch of things that are in current statute. And then it says, and oral nicotine pouches, nicotine lozenges, and other products containing nicotine derived from any source. So my question is that if I sent my niece, who's I think 17 or 18, to the store to go buy me some stuff for my salad, like eggplant, green tomato, a ripe tomato, potato, and cauliflower, which all contain nicotine, would she be able to purchase them?
This bill would not apply to vegetables or other nutritious products that your niece might want to put in your salad or your ratatouille.
But here it says, other products containing nicotine derived from any source.
There are extremely small amounts of nicotine. Oh, I'm sorry. Chair Nathanson,
okay.
Representative
That's okay.
Reschke,
No.
members of the committee. Yes, there may be very small amounts of nicotine, but I believe that our regulations have consistently held that we would not be regulating eggplant, tomato, or other vegetables with this statute and these public health regulations.
My concern is the bill says derived from any source, and there's no limit whether it's 100 nanograms or 15,000 nanograms that you'd find in a cigarette. So just something to think about going forward. Second question is on the penalties. If we look at page 2, line 17, it reads, it removes on line 17 to violate ORS 167.755, which is the penalty schedule right now for violating the tobacco statutes. It starts at $50 and then escalates to $250 to $500 and then $1,000. Why was that removed, or why is that removed? It's removed in two different sections.
Chair Nathanson, Representative Reschke, so this is part of the bill that would consolidate the penalties so that it's very clearly under the public health statute and not under the criminal penalties. So 167755 is criminal statute, and OHA does not enforce those penalties, nor have those penalties been enforced in some time. However, when the Tobacco Retail License Program was created, we did receive authority to enforce civil penalties, and that can be up to $5,000 for violating retail sales laws. We receive, both in hearings with retailers and also concerned calls from retailers, they're concerned that they will be individually criminally responsible for sales by their employee or by someone else in their store. And so the intent of removing 167755 and then right underneath that really clarifying that OHA has the authority under that public health statute to enforce tobacco retail licensing laws, to just make really clear to retailers and everyone else where that authority lies.
Okay, so just so I hear you, we've gone from a graduated schedule that has a cap at $1,000, remove that, and the underlying statute that still remains is 431A.178, which allows OHA to fine up to $5,000. Is that correct?
Rep. Nathan, Representative Reschke. So we can fine up to $5,000. The way that we have applied that in rule is also a graduated penalty schedule that starts at $1,000 for selling to an underage person and then steps up to $5,000 for the fourth offense. So it is still graduated, but it's no longer those individual penalties. So that is accurate.
Okay, and then I guess my third question goes to your comments about the FDA. Reading from their press release on January 25th, quote, "To receive marketing authorizations, the FDA must have sufficient evidence that the new products offer greater benefits to population health than risks. In this case, the data show that these nicotine pouches meet that bar by benefiting adults who use cigarettes and/or smokeless tobacco products and completely switch to these products." So my question is, why would we charge the same tax for a can of Skoal that we would for a can of Zyn? If that then makes the products similar in price, I might as well just keep using the Skoal.
Chair Nathanson, Vice Chair Reschke, I think when we were drafting this bill, we were looking at the cleanest way to create parity with other smokeless products. We don't have public health evidence on the long-term health impacts of these products, and we were also focused on the impact to youth, especially knowing that people who are underage are more price sensitive. And so the cleanest way to create that parity was to include these products in the existing tobacco product regulations. California takes a similar approach. Washington also just adopted a similar taxation approach. Theirs is at 95%.
I know.
Yes, and so this was a similar approach that we recommended here in this bill.
And North Carolina is 10 cents a can. So I just have trouble with, if we're trying to get people to move away from tobacco products, and even though nicotine's not great, it's better, why wouldn't we let them to be priced at a lower rate because of the taxation, so we could get people to move over, and this bill doesn't do that. So, Madam Chair, thank you for letting me ask my questions, and thank you for answering them.
Of course.
Sure. Any other questions? Thank you.
Yes.
Sarah Lochner, and after Sarah Lochner, we will hear from Richard Burke.
Chair Nathanson and members of the committee, my name is Sarah Lochner. I'm the Executive Director for the Oregon Coalition of Local Health Officials, CLO for short, representing Oregon's 33 local public health departments. And I am here today to express strong support for House Bill 2528. Public health has been fighting the fight against tobacco and nicotine products for decades. Many of my members started their public health careers as tobacco prevention specialists, and the issues they were dealing with 10 and 20 years ago are still the same issues they are fighting today. And the tobacco industry is crafty and innovative. They hire the best lawyers to find the loopholes in the laws and then create new products to exploit those loopholes. And they continue to hook our kids with these new products. Products made with synthetic nicotine circumvent our current legal definition of tobacco. So this substance is used in lieu of natural nicotine derived by tobacco plants in mouth pouches, gums, tablets, and gummies, with tasty flavors like mint, cinnamon, and various fruit flavors like raspberry lemonade, for example. These are products that youth can use without teachers knowing, without parents knowing. It's just gum, Mom. So when was the last time you inspected your kid's gum package or your grandkid's gum package? That's why it's so incredibly important to make sure these products are under the same regulations as cigarettes and vaping devices. No sales to anyone under the age of 21, and taxing these products appropriately also makes sense to decrease consumption among price-sensitive individuals like children. Tobacco and nicotine continues to be the #1 cause of preventable disease and death in this country, and billions are spent on tobacco-related healthcare costs. We know that youth who initiate nicotine use are likely to become addicted long-term users. In fact, about 90% of adults who use report that they started as teens. So by closing these loopholes, you will make it harder for kids to get their hands on these highly addictive products. You will improve their health and the health of our state, and you will eventually decrease the cost related to healthcare for these products. An ounce of prevention is worth a pound of cure. So local public health urges you to support House Bill 2528 for the health of our state. Thank you.
Thank you. Questions from the committee? Thank you. We'll next hear from, I'm going to call some names and then give you the rules of process. Richard Burke, followed by Sohail Vasani, then Najib Tajik, and Richard Burke, I will give you up to 5 minutes for a more full presentation, and the other two, after that, we'll start with 2-minute limits on everybody, and there will be at least 10 people in this list who are here in the room. Please go ahead.
Chair Nathanson, members of the committee, thank you very much, and thank you for the time. These are complex issues, and it's hard to cram them into 2 minutes. I'll do the best I can to be efficient. I represent the 21 Plus Tobacco and Vapor Retail Association of Oregon, or VAR 21 for short. We represent 72 stores. Only people 21 and older are allowed on the property. It's not like a grocery store or a gas station. And we would love to work with you and the speakers that spoke previously on how to keep age-restricted products out of the hands of children. We have a lot of ideas about that. We've offered some amendments on legislation to do that. Haven't heard from anybody. And so we're hoping that that will change. We'll be able to work together. I registered neutral on this because there are some things on this bill that, speaking for the association, we have no objection to. For the purpose of taxation, although Vice Chair Reschke his point is well taken about the different taxation levels between the different products. Conceptually, we don't have a problem with considering them the same as, for the purposes of taxation. And we also have no problem with tightening up, clarifying, or creating civil liabilities for those who sell age-restricted products for minors. That's fine. Although I would say that it should be employees as well as owners who are held liable for penalties if products are sold to minors. There are a lot of times when an employee plans to resign, hasn't told his boss, and starts selling to kids. There are a lot of situations like that that could be tightened up a lot if employees were held responsible along with owners. But there are some problems we have with this bill. First of all, treating tobacco and nicotine for regulatory purposes, should be very different. They are different chemically, they have different risks, and they have different benefits. And I think the state would want to preserve the ability to deal with those, to fine-tune a regulatory regimen that maximizes positive impact on health. One disagreement I would have with the prior speakers is that, yes, the FDA has only had a few things that they approve as cessation devices, and some manufacturers have decided not to go that way. But the fact on the street is that people are using these products to get off of tobacco. In fact, it is so successful that the British National Health System now has what they call a swap to stop program, where if you turn in your cigarettes, they will give you free flavored vapes of the flavors of your choice, free of charge. And they think that that will bring smoking down to 5% from current 13% by 2030. It is effective. And states that go the other direction, they're completely missing the boat. And we don't want that to happen. Also, allowing local governments to have their own regulatory systems in addition to the state regulatory systems is also problematic. There are a lot of retail stores who have stores in various counties, and customers are acting in different ways. If you want to tighten restriction, if you want to tighten access, tighten it. But having a patchwork, one of the things that the previous speaker was advocating for was consistency. You cannot have consistency if you have a checkerboard regulatory structure over these products. It's easier for retailers to enforce the law in cooperation with governmental entities. It's easier for customers to know what they are doing. We also oppose using the FDA to set the standard on these things. One of the things that was pointed out by the first speaker was that with all of the terminations and staff shakeups, the FDA, it supposedly reduces their capacity to do good work. So how much faith do we want to put in that? If the FDA is going to get slashed, they wouldn't do a very good job. And they may not be able to deal with the issue in a way that works in Oregon. The way that these problems are addressed are very different in Massachusetts or in California or in Oregon for a variety of reasons I don't have time to go into, but I'm happy to talk to you about it. So let Oregon set its own standard and let it be consistent throughout the state. Don't rely, if you don't like what Trump is doing to the FDA, if you don't like, why are you going to give them this power? It just doesn't make sense. Those are the reasons. There are other people, giving the bureaucrats too much power. You're going to hear other speakers talk about that. But those are the issues that VAR 21 has with this bill. If I could slice and dice this to take out the good stuff and get rid of the bad stuff, I would love to do it. But anyway, I'm out of time. So thank you very much for your attention, and God bless.
Stay there for a minute. Any questions? Yes, Representative Marsh.
Thank you. Thank you, Chair. I'm sorry, maybe I must not have quite been listening, but what do you see as a checkerboard regulation here?
Well, if local and county governments are able to add regulations on top of what the state is doing, you'll have a situation where something's legal in County A, not legal in County B, with regard to the regulation of how retailers sell these products. And so what we want is consistency. You see that with regard to tariffs in the stock market. They want predictability. They want consistency. Part of the reason why the advocates of this bill want you to go forward with it is because they're looking for consistency. But I submit that if local and county governments are able to come up with their own systems, you're not going to get it. You're going to get a checkerboard system of regulation.
Follow up? I still don't get it. We're setting a state standard and state regulatory rules. So what there do you think would be administered quite differently from county to county?
Well, forgive me, I wasn't clear. There are a number of bills that are working their way through the legislature. Some of them would allow for, local governance, and some of them may come this way. And if they do come this way during the course of the legislative session, I wanted to plant that thought into your mind.
One more follow-up. So today's hearing is on this bill.
Yes, ma'am.
So we need comments that are direct around this bill, and we'll deal with other bills in the future. Sorry if I usurped your comments,
No, it's okay. Your point is very well taken. I apologize if I've distracted you. But the vast majority of topics I've brought up are related to this specific bill, and I hope I've been able to meet that standard. Thank you, ma'am.
Thank you.
Any other questions? I have one. You referred to a program in another country.
Yes.
Swap to Stop. Is it to stop using a product with nicotine so as to overcome an addiction, or is it just to stop smoking?
The idea is to reduce the use of traditional tobacco-based cigarettes in favor of the nicotine products. Now, I'm not suggesting that either of these, constitute health food, but it is increasingly known that nicotine-based products that are not laced with black market products are a relative health benefit compared to traditional tobacco-based cigarettes. So that's what their idea is. They're trying to their goal is to reduce the use of tobacco-based cigarettes from 13% now to 5%. And my point when bringing that up is to show you that the relative health benefit of nicotine vape type products is in that health benefit to traditional cigarettes. And so in the context of this larger bill, I would ask that you regulate them differently and don't put them in one basket because they have different chemical, medical, social, economic characteristics, and they should be dealt with individually.
Thank you for the reply. And also, if you had additional information you wanted to share, please feel free to submit it in writing. We can accept testimony for 48 hours from the time that the hearing started. So if you have anything extra to share with us.
That's a good idea. I have submitted written testimony, but that's a good encouragement for everyone else to do it too.
Yeah.
Okay,
Thank you.
thank you very much, Madam Chair.
You're welcome. Next, do we have Sohel Vasani? Yes, please.
Chair and members of the committee, thank you for allowing me to speak today. My name is Sam Masani, and I'm the owner of Speedy Market, Halsey Market, and Step-In Market, all located in Portland. I'm also a proud father of 2 children, and both in my role as a parent and a business owner, I care deeply the well-being of our community. I'm here to ask you to vote no on House Bill 2528 because I believe it would hurt Oregon families, small business, and public safety. As a small business owner, I see firsthand how rising costs are affecting Oregonians. Inflation has made food, housing, and other essentials more expensive, and families are struggling to keep up. Adding an extremely high tax on nicotine pouches would only make things worse for my customers. Many of them are hardworking individuals who are already stressed thin. This tax would unfairly target them at a time when they need relief and more financial pressure. I'm also concerned that when legal products become unaffordable, consumers often turn to illicit market. Illegal sellers don't check IDs, don't follow regulations, and don't care about protecting our youth. As a responsible retailer, I take pride in the safeguards we have in place. My employees are trained to card every customer, and we use ID scanners to ensure compliance with the law. We are committed to keeping tobacco products out of hands of minors, and this tax would undermine these efforts by driving sales to illicit sellers who do not follow the rules. This is not the direction we want for Oregon. Small businesses like mine are the backbone of our community. We provide jobs, support local economies, and serve as a trusted community stores. This tax would hurt small business like mine at a time when Oregonians are already struggling. This bill would only add to our challenges. For this reason, I respectfully ask to vote no on House Bill 2528. Thank you for your time and consideration.
Thank you for your testimony. And after this speaker, we will next have Matt Evans, then Laurie Kimmel. Okay, it's your turn.
It's my turn, okay. Good afternoon, Chair and Committee. My name is Najib Tajik, and I'm here today to represent my family.
We own 3 stores in Portland area, and I'm asking you to vote no on House Bill 2528. My brother came to United States in 2014 with a dream. In less than 2 years, he bought his first stores. Today, we've grown to 3 locations. A testament to hard work, family, and community. This isn't just a business, it's our livelihood, supporting my brother, our employee, and neighbors. We take responsible retailing seriously, checking every ID, training our staff, strictly following the law to keep products away from minors. But higher taxes won't stop kids. They'll just drive sales to illegal sellers who don't care about rules. Meanwhile, Oregonians are already struggling with soaring prices on grocery, rent, and gas. Why make it harder with another tax that hurts small businesses and consumers? This bill doesn't solve problems, it creates them. It will strain our stores, risk jobs, and push shoppers towards unsafe alternatives. We're asking for a fair chance to grow, not another hurdle. Please vote no on Bell's House. Thank you.
Thank you for your testimony. Next, we will hear from Matt Evans and Laurie Kimmel and Chong Sullivan.
Good afternoon, Chair Nathanson, members of the committee. Thank you for the opportunity to speak with you this afternoon. My name is Matt Evans. I'm a native Oregonian, and I'm here representing the Taxpayer Association to urge a no vote on HB 2528A. I want to quickly address the disconnect that we see between this body and how you are able to do your jobs. Oregon's general fund is almost wholly dependent on personal and corporate income tax revenues. A thriving, diverse economy is essential to the success of government in Oregon. We take a lot of actions designed to bring large businesses to Oregon or to encourage them to expand here. But the Office of Economic Analysis would tell you that small businesses provide most of the jobs in Oregon. This bill could allow a dramatic and perhaps fatal injury to a large number of small businesses in our state. It could shut down hundreds of tax-paying small businesses and put thousands of tax-paying Oregonians out of work. State government is already claiming to be facing a large deficit in the coming biennium. Decisions made under this bill will make that problem worse, not better. We encourage you to always consider your decisions in light that the strong economic activity in our state is the only thing allowing you to fund what you truly care about. We urge a no vote on HB 2528A. Thank you.
Thank you.
Chair Nathanson, Vice Chair Reski, and members of the House Committee on Revenue. My name is Laurie Kimmel, for the record. I am a veteran. I'm original Oregonian. My forebears came on the Applegate Trail. I am not in favor of this bill. This bill represents excessive authority granted to the OHA and impacts all Oregonians and Oregon family businesses by giving them the ability to tax. This bill is not about public health, but taxation. The ability to tax granted to the OHA bypasses the voters and an elected legislative body. Oregonians do not need an unelected entity to have the ability to tax and decide what is best for Oregonians. There are not any checks and balances in this bill against taxation. This bill has the appearance of taxation without representation and violating free will. Thank you for your time, and this concludes my testimony.
Thank you. And after this speaker, we will hear from Brian Orkilla and Emily Souls.
Madam Chair and members of the committee, my name is Chong Sullivan. I'm here today representing the Korean American Grocery Association, KAGRO. In Oregon, there are more than 150 KAGRO stores across the state. Today, I'm here to urge you to oppose House Bill 2528, which proposes large tax on nicotine pouch products. This bill will have serious negative effect on KAGRO stores that serve community across our state. KAGRO represents first and second generation Americans who have worked hard to reach their American dreams. Our members have convenience stores, grocery store, gas station, and liquor stores. These businesses are more than just stores. They are essential businesses that are part of their community. We take pride in following the law, helping our neighbors, and contributing to Oregon economies. Our store creates jobs, pay taxes, and help support Oregon's economy. Nicotine pouches are legal products and an important part of our business. The proposed tax increase will place an unfair burden on small business owners. Like most Oregonians, our small businesses are already struggling in the face of rising costs for housing, food, and other essentials. This tax will not only hurt small businesses, it will hurt consumers. Taxes are too high to drive people to the illicit market where the products are unregulated and sold without safeguard like ID checks. Responsible retail like KAGRO members are committed to protecting our communities. But this tax will hurt those efforts by pushing sales into illegal market. We ask you to consider the broader impact on this bill. At a time when Oregonians are already facing financial challenges, this will burden Oregon residents and small businesses. For this reason, I ask you to oppose House Bill 2528. Thank you very much.
Thank you.
Thank you.
Brian and Emily?
Chair Nathanson and the committee, I'd like to thank you very much for the opportunity to speak today. So my name is Dr. Brian Erkala. I am the Senior Advisor for Scientific Engagement at Swedish Match North America, the manufacturer of Zyn nicotine pouches. I've studied nicotine for about 25 years, including positions at the National Institutes of Health and the FDA Center for Tobacco Products, where I was lead toxicologist. I would like to tell you a few reasons I am in opposition to this bill. This measure paints all tobacco products as equal risk when scientific consensus and the FDA acknowledge lower levels of risk for smoke-free products. It also hinders the more than 350,000 adults who smoke in Oregon, many of which are price sensitive, from making better choices about their well-being. One of the very last public health measures taken by the Biden administration was to authorize these pouches as, quote, appropriate for the protection of public health. Now, they did this for three main reasons. The first was the incredibly low levels of toxins compared to other products like cigarettes and smokeless tobacco. The second was that smokers substantially switched to these pouches and stopped smoking. Many of those also, they found that the flavors that these come in, flavors that have been found in smokeless tobacco for decades, facilitated that switching. And lastly, that youth use was very low. So the Nonpartisan Tax Foundation has looked extensively at this issue and determined that legislators should incorporate harm reduction into their tax structure. That is, taxation proportional to risk. Cigarettes being taxed the highest and lower risk much lower. HB 2528 does the opposite. It reduces the financial incentives for people who smoke combusted cigarettes to switch. And we've seen in other locations that this can actually increase combusted cigarette use. So over 5,500 Oregonians will lose their lives this year to combusted cigarette smoking. HB 2528 will do little to change that, nor will it reduce the $1.8 billion in healthcare or $4 billion in productivity. I urge you to reject this measure.
Thank you. If you weren't able to complete your comments, if you had anything in writing, please feel free to submit it.
Okay, of course.
Yes.
Thank you. Chair Nathanson, Vice Chair Reschke, Vice Chair Walters, and members of the committee. For the record, Emily Souls here today representing the Oregon Small Business Association in opposition of House Bill 2528. The Oregon Small Business Association is dedicated to advocating for policies that foster a healthy and competitive environment for small businesses across the state. Our members have expressed concerns about the impact of this bill on their businesses and consumers. For Oregonians, managing the already high cost of living, raising prices is always a concern. Many consumers are exploring different nicotine options with harm reduction in mind. Pricing and availability can influence consumer choices, which may lead them to a more affordable but far more harmful product. We also note the concerns raised regarding the potential for unintended consequences, such as the growth of an unregulated market if legal product prices become significantly higher. Ensuring that legitimate licensed retailers remain the primary source for these products is key to maintaining safety standards and age verification controls. Our members, the small businesses who operate retail establishments in communities throughout Oregon, are committed to being responsible retailers. They play a vital role in our local economies, providing jobs and convenient access to goods. We ask that you consider the needs and the concerns of Oregon small businesses before moving forward. Thank you.
Thank you for the testimony. Next, we will hear from, and the rest of these are marked on my list as being remote, so we may be shifting to watching screens. Matthew Warren, then Brett Shimamura. Matthew, are you there?
I am here, yes.
Please begin.
Chair and members of the committee, my name is Matthew Warren. I am the General Manager of Fuel Options LLC located in the Portland metro area, Milwaukee, and Scappoose. Thank you for providing me the opportunity to speak today. I am here today to ask you to oppose House Bill 2528. Oregonians are already facing high inflation rates and rent increases. Our customers pay their fair share in tobacco taxes, and increasing these taxes further burdens them when they can least afford it. It is also important to note that the products targeted by this tax hike are considered by the scientific community to be less harmful than cigarettes. The illicit market thrives when legal products become unaffordable. This proposed tax increase could undermine public health by pushing the sales of these products to the illegal market where criminals don't care about checking IDs. Retailers like our stores are the front line to keep youth from accessing tobacco products. We take this responsibility very seriously. We train our employees and scan customer IDs before every purchase of tobacco products to ensure that no one under 21 years of age can purchase them from us. We also pay for a program where WeCard does random audits, and we reward our employees for successfully refusing sales to minors. I invite you to visit our stores if you would like to learn more. We are proud of the work we do to ensure responsible retail practices, and we believe that excessive taxes like the one proposed in House Bill 2528 would undermine these efforts. Thank you for your time today. Please oppose House Bill 2528.
Thank you. Brett Shimamura, followed by Nirdash or Andy Daka. Go ahead. We can't hear you.
There we go.
Good.
Okay. Sorry about that. Chair and members of the committee, thank you for the opportunity to speak today. My name is Brett Shimamura. I'm the Assistant General Manager of Fuel Options LLC, which operates 3 neighborhood stores in the Portland metro area. I am here today alongside my colleague to respectfully ask you to oppose House Bill 2528. Oregonians are already facing significant financial challenges. Inflation is driving up the cost of housing, food, and other essentials, and many families are struggling to make ends meet. Adding a steep tax increase on nicotine pouches would only worsen the financial burden on our customers. This is not what hardworking Oregonians need right now. Beyond the cost to consumers, this tax increase could have unintended consequences for public safety. When legal products become unaffordable, the illicit market thrives. Illegal sellers don't check IDs, don't follow regulations, and don't care about protecting our youth. Excessive taxes would push away sales from responsible retailers like us and into the hands of criminals, undermining public health and community safety. At Fuel Options, we take our responsibilities as retailers very seriously. Carding every customer, preventing anyone under 21 from purchasing tobacco products is a core value for us. We are proud of our efforts to protect the community and invite you to visit our stores to see these safeguards in action. In closing, I urge you to consider this impact this tax would have on Oregonians, small businesses, and public safety. For these reasons, I respectfully ask you to oppose House Bill 2528. Thank you for your time and consideration.
Thank you.
Thank you.
Hasib? Please go ahead.
Am I the next, Nirdos?
Oh, I'm sorry. Nirdosh, Andy? Is this Andy?
Yes, that's me.
Yes, please go ahead.
Chair and committee member, my name is Andy Dhakal, and I'm the proud owner of 4 convenience stores in Greater Portland area. Thank you for giving me the opportunity to speak today, and I'm here to ask you to oppose House Bill 2528. As a parent of 2 young children, I care deeply about the safety and well-being of our community. It is of paramount importance to me that tobacco and nicotine products are sold only to adults 21 and older. Responsible retailers like me are the first line of defense in preventing kids from accessing these products. We take this responsibility very seriously, following strict protocol to ensure compliance with the law. Today, I'm here to talk about the unintended consequences of the nicotine pouch tax proposed in House Bill 2528. When taxes rise too high, it creates a ripple effect that hurts everyday Oregonian. Now, especially in regarding pouches, FDA recently approved these products because of significantly lower level of harmful chemicals. My thought is it will be unwise to add more tax, especially if it's better alternative than the regular tobacco products. Our state is already facing financial challenges, and Oregonians are dealing with rising costs in every aspect of our lives, from housing to groceries. Adding another financial burden through higher taxes is not what Oregon customer needs right now. Please oppose House Bill 2528. Thank you for your time and for listening to the concern of a small business owner and a proud parents and a proud Oregonian. Thank you.
Thank you. Hasib Shojai, followed by Kaiser Couch or Cooch. Hasib, are you there? Hasib? Kaiser? Go ahead.
Hello, Chair and committee. I'm Kaiser Couch, a Central Oregon C-store owner, urging you to vote no on the 65% nicotine tax bill. This tax targets pouches and vapes, which are safer tools my customers use to quit deadly tobacco, and I used myself to quit tobacco. My doctor and experts nationwide agreed, nicotine's safer, tobacco is the danger. These products cut harm by 95% and help 70% quit smoking. Taxing them, like cigarettes, ignores the science and punishes quitters. In Oregon, we're reeling with economic devastation of COVID, inflation, and high interest rates have caused for us. This tax hikes pouches price from $5 to $8, slashing my sales 20 to 30% instantly and hitting struggling families in our community. Our community, which 30% using pouches to quit, can't afford this. Please keep pouches and vapes affordable so Oregonians can quit tobacco for good. Vote no to protect our health and wallets. Thank you.
Thank you. Raj Kangura? Raj? She's doing very good at this. Christy? Christy Ab or Abby?
Christy Abbey.
Go ahead.
Okay, my camera wasn't working. It came on just in time. Good afternoon, Chair Nathanson and committee. My name is Christy Abbey, and my family and I own 4 retail stores located in Madras, Prineville, Lapine, and the Dalles. I'm here today to ask you to oppose House Bill 2528A. My parents started our business in 1977 with a $500 loan from a local man. Through hard work, dedication, and commitment to serving our community, we grew that small business into 4 general stores in Central Oregon and the Dalles. Today, we are still a small family business employing about 25 people, many who are family members and longtime employees. Our stores serve small communities offering general merchandise and tobacco products. As responsible retailers, we take great pride in ensuring that tobacco products are sold only to adults over 21. We've even partnered with the Oregon Health Authority to bring ID training to our area, helping other local stores uphold the same standards. We are the first line of defense when it comes to preventing kids from accessing tobacco products, etc. If this tax goes through, responsible retailers like us will suffer. Higher taxes will drive customers to the internet or black market, where unregulated sellers don't check IDs or follow the law. Let me tell you about one of my regular customers, a retired widow named Sharon. Sharon comes into our store every week to pick up groceries, household items, and occasionally nicotine pouch products. Sharon is newly widowed, caring for her mother with Alzheimer's. Like many in our area, she's on a fixed income. Sharon has told us how hard it's been to keep up with rising costs, housing, food, and gas. And recently, she had to pay for the funeral of her sister that died. It's all adding up. If this bill passes, it will make things even harder for people like Sharon. Higher taxes on nicotine pouch products won't just affect her ability to buy them. It will push her to look for cheaper alternatives like the black market or online sellers. Countless Oregonians like Sharon are facing similar financial challenges, and this bill will hurt small businesses, families, and communities. It will drive customers away from responsible retailers like us who follow the law and toward unregulated markets. Please vote no on House Bill 2528A. Thank you.
Thank you. Doug Ball, followed by Josan Singh. Doug?
Hello.
Yes, please go ahead.
Good afternoon, Chair and committee members. Thank you for the opportunity to speak to you today. My name is Doug Ball. I'm category manager for Jackson's Food Stores. We own 317 convenience stores in the West, including 56 in Oregon, from Eugene to Portland and LeGrand to Ontario. I'm here to oppose parts of HB 2528, specifically the proposed 65% wholesale tax on nicotine pouches. We support closing any loopholes, allowing minors access to nicotine products of any kind. We do not sell any synthetic nicotine products to those under 21 in our stores, and we do not support that. Earlier, it was stated that the same youth tobacco problems of 10 years ago are still around today, and that's simply not true. In the 2024 National Youth Tobacco Survey by the FDA, cigarette usage set another all-time low point among youth last year. Vape usage has come down 72% since 2019. It's under 6% last year. It was 20% 5 years ago. Nicotine pouch usage did not show a statistically significant change and was at 1.8% last year. Adult usage has increased 30% year over year the past several years, and yet these are not popular products among youth. Decades of anti-smoking campaigns have driven youth usage of cigarettes to all-time lows. The newer anti-vaping campaigns are doing their job. We're seeing great numbers in youth turn around on vaping, and only more to come with that. Nicotine pouches are not popular among youth, and we need to do the right education, have total anti-nicotine campaigns to keep them not popular among youth. Who they are popular with is the adults that are switching from more harmful products. The FDA has published a continuum of risk with cigarettes and moist tobacco or chew at the high side. Most harmful nicotine pouches are the least harmful. We know our customers are switching to this because we see it every day in our sales. Our customers, our managers see it. Our sales on cigarettes and chew are down over 15% year to date in our Oregon stores. Where the growth is coming from is the nicotine pouches. This proposed tax would would cost a 1 can per day user over $1,200 per year. Now, I'm old enough to remember when these were called sin taxes. They were taxes that were implemented to change or curb behaviors. If our customers are currently switching to less harmful nicotine products, why do we want to then to tax them at the same rate as more harmful products? That's what I have today. Thank you for your time.
Thank you. Josan Singh, followed by Kevin Kumar. Do we have Josan Singh? Kevin Kumar. Go ahead.
Yes. Good afternoon, Chair and committee members. My name is Kevin Kumar, and my family owns several convenience stores along the Oregon coast. We're proud to provide 15 jobs across our locations, support local organizations, and ensure that our customers have access to essential goods. We are a small family business, and we take compliance very seriously, especially when it comes to tobacco and nicotine sales. I'm here today to ask you to vote no on House Bill 2528. Oregonians are already struggling with the rising cost of living. We see it every day in our stores. From housing to groceries, everything is getting more expensive. Adding a 65% tax on nicotine pouch products is not what our customers need right now. It is excessive and unfair. Many of our customers are working class, and another tax like this forces them to make hard choices about how they spend their money. This bill will drive people away from legal, regulated businesses like ours and into the illicit market where there are no ID checks and no accountability. That hurts public safety and small businesses at the same time. Countless Oregonians are facing similar financial challenges, and this bill will only make things worse. It puts jobs at risk, takes money out of our communities, and silences the voices of responsible retailers who are doing things the right way. Please vote no on House Bill 2528. Thank you.
Thank you. Jonathan Polonsky? Jonathan Polonsky.
Hello, Chair Nathanson and committee members. My name is Jonathan Polonsky. I'm the CEO for Plaid Pantry. We own and operate 104 convenience stores in Oregon. I'm testifying in opposition to HB 2528A because I believe taxing products that many combustible cigarette users have migrated to will have the effect of moving them back to tobacco products that are known to be the most harmful. Based on data posted by the Oregon Health Authority, which I have submitted in my written testimony, the use of cigarettes by Oregonians is at an all-time low. The dramatic decline over the past 10 years has been driven by three main policy changes. First, increasing the age a person can buy cigarettes from 18 to 21 back in 2018. Second, a huge tax increase in 2020. And finally, the addition of state tobacco licensing and the related enforcement that started in 2022. HB 2528A has the potential to undo some of the progress that has been made in reducing cigarette use, because it will put a massive tax on what the FDA has identified as potentially reduced exposure products. Raising the price on products that incentivize smokers to quit makes no sense, particularly after the progress that we've made to reduce the use of cigarettes over the past decade. I've included some retail sales data in my written testimony that illustrates this point. Lower cost nicotine products are the best path for smokers to switch to reduced risk options. We know all tobacco taxes typically hit consumers who can least afford it most. Adding a regressive tax on these alternative nicotine products punishes adults who want something other than cigarettes and may force them back to smoking. Thank you for your time.
Thank you. And one last invitation to Josan Singh to testify. Not responding. Okay. That completes the list of everyone who had signed up to testify for today's public hearing. Committee, any questions for LRO? I do have one. I would appreciate it if Legislative Revenue Office would reach out to either Dr. Urkela or Oregon Health Authority to send any brief summary. I don't need to see 30-page research studies, but some summaries to help address what appears to be really conflicting testimony we have. We've had testimony that nicotine is not a problem, tobacco is the problem. On the other hand, we hear about the harm of nicotine addiction. These are separate things, perhaps. You can consume or derive the effects of nicotine by taking it in different ways. But nicotine is a substance in tobacco. Nevertheless, we've had people say that there is no harm with nicotine, there is with tobacco. And that just, it's not consistent with other information we've received. So could you please get us a couple of summaries of people's points of view and why they're expressing it that way?
Yes, we will certainly do that.
Thank you. Anything else? Thank you, everybody, for.
Just one question.
Yes.
Do we have anywhere in the record an indication of how much the product would, on average, increase with the, as taxed as proposed?
The final price?
Yeah.
Yeah.
Some sample products. Maybe it's there and I haven't found it yet.
So I think we heard testimony, somebody said $5 to $8, but with a 65% wholesale price increase, it's going to be probably 80 or 90% increase in a retail price.
Okay. That's helpful. That's the rule of thumb that you could use on that.
Why don't you say out loud, that was kind of shorthand, how do you get from A to B, it's not 65%?
Yeah, so there's a markup. There's a markup at the retail level. What I've looked at is some information from how the price changed in Maine when Maine started taxing the products, and kind of based on what their tax by wholesale price was versus ours.
Mm-hmm.
That's where I came up with that. It's we're kind of in uncharted territory, so we don't know for sure, but that's the real world experience I would base kind of a price elasticity analysis on.
Okay, thank you.
Of course.
Okay. Thank you all, and thank you everybody in the room for staying with us for the public hearing. I'm closing the public hearing on House Bill 2528A. There is no other business. Wait, yes, Representative Reschke, sorry.
Revenue forecast tomorrow, when?
yes.
When?
8 a.m.
8 a.m., all right.
I might be a few minutes late because they scheduled my bill for a hearing at 8 a.m.
Congratulations.
Rules.
I doubt that they will hold the forecast till you get there.
I know. So that's why I said I'm going to be late, not them. Yeah.
Right. Thanks for letting us know.
Yeah. My chief said, can't we just text him and say, we hold the meeting for like 10 minutes for you to testify? I said, I don't think so.
Not that one.
That one they won't.
Not that one. Anything else? Thanks, everybody. We're adjourned.